Still admitting a few more people and then we'll get started.
Nice point side. Gets the same.
Okay, so we're about sorry, feedback. So we're about to get started. Go ahead and scan the QR code if you want to enter into our giveaway for the gift card. And it also has access to all of our social media accounts. We made it very easy by giving you guys the Linktree link. And yeah, we are giving away gift cards for this. And it's really easy. You just take a screenshot of you following the accounts and then send it to blackhealthfacts.net@gmail.com. It also gives you access to our pre-event survey, and there'll also be a post-event survey with the same questions. Ashley, go to next slide. So again, this is about our giveaway. So it gives you the email right there. And we're doing this for both webinars. So we have another webinar coming up April 25th. So feel free to enter both times if you would like. And I'll give you guys just a moment so you can scan the QR code with your phones if you would like to. Okay, next slide. So my name is Brianna Dawson. I'm the webinar co-producer, and I go to George Mason University where I am a community health major. I'm also an accelerated master's program as well. I'm a content creator, so part of what I do for Elevate Her is I'm a campaign manager. So I work on all the social media platforms and also manage our mobile app and organize events. I'm also a Zoom instructor, so I actually came from a class right before this. And so I'm excited to be here with you guys. There is a 10-minute workout period in here, so I'm pumped right now to do it with you guys. And Ashley will also introduce herself.
Good evening, everyone. My name is Ashley Dawson. I'm her twin sister, just in case you're worried if you needed glasses. I'm also in the Accelerated Master's Program. I'm a dance studio owner, and I'm the development specialist for Elevate Her. And I'm glad to see you all here today.
And next slide. So just a reminder that this webinar is being recorded. It's also being on YouTube Live as well, so it's live streamed on there. And you are allowed to ask the speakers questions, but if we can't get to your question, feel free to drop it in the chat and one of the speakers will answer it through there, or we will attempt to answer it through email and get back to you. And we'll also post it on our social media accounts, which is another reason why you should follow us. And today we have Fatima, our project coordinator, who's actually going to introduce our new diabetes prevention program. And that's what this webinar is really about. And then we also have two speakers that will be presenting on diabetes and lifestyle changes. And actually, some have actually even lived through diabetes. So let's get started. Next slide. So these are our panelists. If you guys want to each say your names real quick.
I'll start. My name is Fatima Karoma. I'm the program coordinator. You're probably seeing my face with a background and then my face without. Technical difficulties, we got to do what we got to do. So boom. I am in charge of the diabetes prevention program that we are launching. And I have some of my team here today who will introduce themselves a little later on. Unfortunately, Miss Val is having some technical difficulties, so I'll introduce her as well. She's the founder of Elevate Her and a public health Blacktivist. So the entirety of this organization is, her mind and her ethic come into fruition. So unfortunately, she's not here to speak, but I'm sure she's, joining in and listening in. So yeah.
Hi, my name is Geneva Pearson, and I am one of the guest speakers for today. I am a retired nurse, and I also work with another diabetes organization. And I am interested in seeing what we can do to decrease the frequency of diabetes in our community.
Hi, I'm Sharon Hawks. I'm the owner and director of the Nutrition Diabetes Education Center in Glendale. My whole passion is about nutrition and diabetes, so I'm excited to be with you guys tonight to talk about that, particularly when it comes to Black women.
Thank you guys for introducing yourselves. Next slide. And once again, Fatima will be taking over Ms. Valerie Davis' slides due to technical difficulties.
So a little bit about Miss Valerie Davis. She's a dancer. She's searching for a friend to conquer the trapeze. She's a single mama of a brilliant 14-year-old daughter named Lena. And one of her goals is to visit every country. So I'm going to facilitate the conversation on her behalf and, ask questions and do things like that. So please bear with us as we're working through our technical difficulties. Thank you all for showing up and being here. And we look forward to connecting as a community. So why are we here? The health of Black people in this country is in a state of emergency. And I think that it always has been. There's never been a time where I think we can say we've had optimal health. We've struggled in every way in this country. And as of now, our life expectancy has declined by 2.9 years since 2019 due to the onset of COVID. And the health disparities just continue to increase, whether that's pregnancy, whether that's diabetes. The disparities amongst white women versus Black women continue to get wider. And so one of the reasons why we're here is because we see a problem and we want to do something about it. Black women have been disproportionately displaced from employment during the pandemic, the only racial and gender group with an increased monthly jobless rate in December 2021 at 7.72%. So not only are we getting targeted, with all of these health issues that are coming our way, we are having a more difficult time finding employment during this pandemic, making it harder for us to stay healthy, to keep up with doctor's appointments, to keep up with our livelihoods. Our pre-pandemic lack of well-being persists, killing us loudly and softly. Black men and women are more than twice as likely to die from diabetes as white men and women. What is the connection between diabetes and COVID-19? The spread of COVID-19 is not over and Black people are not fully protected. The cases are trending upward in some states and variants are still emerging. We have the lowest full vaccination rate at 41%, and federal funding is not available for more national or local COVID-19 responses. So to make that long-winded thing into something, a little bit more digestible, COVID isn't going away as much as the government is trying to tell us that it is. And with that being said, Black and Brown people are going to continue to suffer the most, whether that's because we're the frontline workers or because of health issues such as diabetes or other conditions that we have, underlying conditions that affect Black people more than they do others. People with underlying medical conditions like diabetes are more likely to develop serious illnesses and die from COVID-19. So although we've had the rollout of the vaccine and there's been, some states it's trending down and things are looking up, there's still a lot of hesitancy in the community about vaccines. And as well as people who are getting these vaccines still have these underlying medical conditions, which can sometimes make it a little bit more difficult for their bodies and their immune system to protect against COVID-19. We're also learning about the effects of COVID-19 on our long-term health, and we will continue to be learning for probably the next couple of decades. So it's important that we kind of look deeply into how it has affected our community so that we can see how we can move forward as a community and continue to optimize our health and wellness. So the question is, what are we prepared to do to protect ourselves and heal ourselves from illnesses that plague Black communities before the pandemic? So we're kind of going to get into speaking with our presenters. We're going to hear from a diabetes champion. We're going to dig deeper into the diabetes connection with COVID-19. We're going to heal with exercise right now, and then we're going to grab a free opportunity for Black women to prevent diabetes now through the launch of our program, which we'll be speaking about as we continue throughout this webinar today.
Good. Okay, cool.
All right, so I'm going to pass it over to Miss Geneva, who's going to talk a little bit about her own experience and her take on diabetes.
Sorry, I didn't unmute myself. Hi, everyone. I am Geneva Pearson. I am a retired registered nurse, retired in 2011. And I also received a Bachelor of Science degree in psychology just a couple of years ago in 2019. I was 70 years old when I finished that degree. So what I'd like to say to everybody is never give up, continue on whatever dreams you have. It's never too late to complete what you started. The other thing in my life, I enjoy traveling to Germany. My son lives in Germany, and I believe I've been over 4 times. Of course, when my grandchildren were born, I went over, and then we went on a couple of pleasure trips. So I enjoyed that. I am a wife, and I am a mother of 2. I have 1 grandchild here in Maryland, and the other 2 are in Germany. And next slide. I also spent 41 years as a practicing registered nurse. While practicing, I served in pediatrics, a long stint in oncology and home care, and then short terms in other areas. I also enjoy assisting with health fairs and medical education in the religious community. Now I continue to assist family and friends as needed with their personal care or health issues. Some of the questions you might ask, what some of the trends that we may have when we look at diabetes in the Black community. More than 30 million Americans have been diagnosed with diabetes. This is type 1 and type 2. And the numbers are gradually growing. If you think about it, there are things that you can think of that does contribute to this. One of the things is just the community, the computer itself, because we are sitting all day long. So what is that? Lack of exercise. 11.7% prevalence is among Black people versus 7.5% in white people in the United States. The percentage in Asian and Hispanic populations is about 9.5, so it's somewhere in the middle of the Black and the white. What effect does stress have on diabetes? It has a lot to do with diabetes. Whenever you're under stress, it's very, very difficult to control your glucose numbers because you're going through a lot of different changes. Your blood pressure is elevated. Your heart rate is much faster. And there are also hormones being released that increase the blood sugar. 2 of those hormones are cortisol and adrenaline. And we know about the adrenaline. But those are the primary ones that change during the time that you are under stress. And we know our society now is very, very stressful, not only in the work environment, but also in the home setting. Everywhere, there's just stress. If you're driving down the street, there's stress. So we have to look at how is it affecting us individually. The next question is, does the Black community experience more complications from diabetes? And as a Black person, I think I need to say yes. We tend to experience more complication than other groups in the area of retinopathy. We know that's dealing with the eyes, neuropathy, and also end-stage renal diseases, which is 2 to 5 times greater in the Black population than it is in other populations. Also, we have a high frequency of lower limb amputations. As a people, we do not take care of our feet like we should. We should be going to the podiatrist, or we should be having someone to look at our feet. Do it yourself if you have to, but we need to take care of our feet because a lot is connected through your feet to all the other parts of your body. If you look at charts, you will see how even the heart, there are different areas in your feet that if you manipulate them, it will affect the organ that it's connected to. There are a lot of racial disparities that are linked to causes such as the environmental causes, physiological causes, social economic, and also genetic factors. Next slide. Okay, what are some symptoms and risk factors for diabetes? Some of the symptoms of diabetes occurring are increased thirst, frequent urination, headaches, blurred vision, weight loss. Also, obesity and a sedentary lifestyle are the most prevalent risk factors in diabetes. And I can kind of like tell you a little bit about that. I have been given a diagnosis of type 2 diabetes, which occurred recently. That was in 2010. I guess that's not really recent, but that's about 12 years ago when I was diagnosed with type 2 diabetes. And my response was initially denial. And that's usually the response with most people. They were like, oh no, that can't be happening to me. And in particular, I thought that it was impossible because I knew pretty much everything there was to know about it from a nurse's standpoint. So I was like, oh no. So it took a couple of years for me to really come to the point where I said, okay, this is what it is. I just need to deal with it. Right before that, I had made changes in my job location. And the job that I took did not require as much walking as I was accustomed to. There were a lot of changes that happened along that time without going into a whole lot of detail. But those changes, when I look back, those were the things that probably caused me to all of a sudden have higher glucoses than I did before, because right prior to that, I was doing good. I was looking good and everything. I was a size 8. Just really feeling good. All my numbers were in order. But then when I made this change where I was in a sedentary lifestyle and started gaining weight again, that was when the changes happened. So we have to look at what we're doing and make sure that we find some kind of balance between what we're doing, make sure that we're living a healthy lifestyle. Type 2 diabetes is the one that's most prevalent in the Black community. Type 2 is when your body is just not utilizing the insulin. In type 1, the insulin is not being made, to keep it simple. But in type 2, it's not being utilized properly. So this is one of the things that we have to deal with. This is one of the things that we need to look at with our families, with our community, make sure that we are doing things that are healthy. I know it is a problem, as I mentioned earlier, about the environmental factors. Some communities are don't have healthy stores. You know, they're food deserts where they cannot get to the foods that they need to eat. And then we're training our children to eat the wrong things, the fast food and all of those things. So we need to change the way we think about food, change the way we think about exercise and all of those things. And I'm pretty sure you hear more about that, but those are the things that we need to do. Thank you much. Now, Miss Sharon is going to talk to us a little bit about her work and her experience with diabetes.
Good evening, everyone. I'm Sharon Hawks. As I said before, I'm a registered licensed dietitian nutritionist. I'm a certified diabetes care and education specialist. To tell you 3 fun facts about me, no one ever seems to be surprised, but I'm a retired Air Force major. I'm one of 9 kids. 5 of them are males, so hence my strong personality, as people love to tell me. So I have 5 brothers, and they all are older than I am, so you imagine. I have visited all but 3 states, United States, and I have been to 3 of the U.S. territories. I've been to Puerto Rico, Guam, and the U.S. Virgin Islands. I've probably been to about 15 countries, lived in about 3, so love to travel. Love to travel. So I'm hoping to knock out those last 3 states here in the next coming year. It was my goal 2 years ago, and then the pandemic hit. So I'm going to be taking care of that. So I can say I have visited all 50 states and territories. Someone needs to mute there for me. There we go. I have over 25 years of experience in diabetes education, nutrition, fitness, and wellness. I love to start off by saying I'm a registered licensed dietitian, a certified diabetes care and education specialist. I'm a certified fitness instructor. I'm the owner of the Nutrition and Diabetes Education Center. I'm a retired Air Force officer. I'm a mother, I'm a wife, and I'm tired, y'all. So I got a lot going on, but loving it because my passion is working with women, particularly Black women in the area of nutrition with the focus on diabetes. My business, the Nutrition and Diabetes Education Center, is in Glendale, Maryland. If you guys know where that at, I think some of you probably live in the area. What else can I tell you? Pretty much that. So let's move right on. I want to talk a little bit about some of the questions. Question number 1. Why do Black men and women have a greater risk for diabetes? I get asked this question at least 15 or 20 times a week. Not only do I see tons of patients a week with diabetes and pre-diabetes, I also do once a week a major class on diabetes education and training. So this comes up a lot. And I love to say, and I need for people to hear this, what we do know about type 2 diabetes, which was mentioned earlier, is the most prevalent in the Black community, is family history. I always say to my patients, what brought you to the table is family history. Now, what set you down was your lifestyle, but what brought you to the table was your history. So making sure people understand that, because there's always this question about why me and why not Sally down the street? Well, Sally down the street may not have the family history. So for them to understand that, that gives them a little bit of relief. Don't take them, take all the concern away, but it at least helps them to know that why they ended up with diabetes or with pre-diabetes, it was because of family history. So their dietary choices, of course. We know in our community, we love our food. Everything about what we do is surrounded about food. When someone get married, we what? We eat. When someone die, we eat. When right? A new baby's being born, we eat. And if you show up and the food's not there, we're not happy, because we have been trained that when it's time to celebrate, we eat. You got it? So I want to challenge you to understand that this issue of diabetes is very complicated or complex in our community. Inactivity. I love what Geneva said earlier about what happens a lot of times to people when they change jobs. But think about what has happened here in the middle of the pandemic. A lot of people I know went from getting up in the morning, going to the metro, catching the metro, walking 3 or 4 blocks to their job, walking halls all day, and then they turn around and do it back at the end of the day. I have a friend who before the pandemic got in over 20,000 steps a day on average. And now she went down to 2,500 steps a day. So that's going to make a big difference in how your body is going to respond. So the inactivity, even prior to the pandemic, we're not famous for being very active. I'm really excited about our young people coming along because you guys are serious about making those changes and making sure that health is a part of who you are. So if we can get moving more, that's going to make a difference. I can't stress enough, no pun intended, well, how stress plays a role in our overall health. It is believed that particularly in the Black community, there was some research that suggests that the most stressed out person in the United States is the Black male. My response, I think Black women will disagree with that. I don't know who did that survey, but who's stressed out is a Black woman, right? So we spend a lot of times being everything to everybody else. And at the end of the day, we have nothing left for ourselves. And so I spend a lot of times as a health coach, as a life coach, helping people to understand, particularly women, that they have to make sure. I used to say, you got to put yourself first. Then I realized the Black woman's not going to do that. So I resorted to saying, can you put yourself in the top 5? And you won't believe this, but I have some patients who can't even put themselves in the top 5. I think the dog comes before they do. So it's important that we make sure that we take care of ourselves, find ways to reduce stress. And bottom line too, here's a lack of knowledge. You know the old adage that knowledge is power. That is powerful. I make the point to my patients, I'm so disheartened when patients come in to see me who've had diabetes for 15, 20 years, who have never had education before. And literally by going through my class and sitting down with one-on-one, they go from 9, 10, 11 A1Cs, if you know what the A1C is, down to a 7 within 3 months. They've never seen numbers like that. And it's not just because I'm good at what I do, it's because they have the knowledge that they needed. So I'm really excited about you guys doing this program, the Diabetes Prevention Program, because it's really going to make a difference in our communities. Again, knowledge is power. When you have over 80 million people in the United States have pre-diabetes, we know that if nothing is done within 2 to 5 years, they will have full diabetes. So by making sure we address it at the early stages, we can keep them from progressing into diabetes. Next slide. So the second question was, how can reducing diabetes reduce your COVID-19 risk? This was a big one for me over the last 2 years. I belong to one of the mega churches in the area, and I'm actually the health commissioner for the entire area. And we were one of the few sites, church sites, that actually did vaccines and did education on COVID-19 and all the new information that was coming out. I was really disheartened in the community, as Geneva was saying earlier, about how we lack so much information in our community. And one of the biggest issues when it comes down to the issue of COVID-19 is that we did not receive all the information a lot of times. So I spent a lot of times trying to educate people on what is COVID-19, what does it look like? It's their choice to take the vaccine, but making sure that they have all the information. So by doing that, we saw the changes over and over again as we were learning. In the medical field, we understand that when you're researching something, things are going to constantly change and be updated. But for someone who understands that, they took that as being, they don't know what they're doing. Right? So a lot of what was happening, particularly in our community, was a lot of misinformation. So what I came to understand about diabetes in particular is we got to know that diabetes is a systemic disease, meaning that it affects every system of the body. And so does COVID. So imagine that. If COVID's response is when you contract COVID, that it affects all systems of the body, and then you have diabetes, which also does the same thing. This is what put a lot of the patients with diabetes, particularly my patients who were uncontrolled, into a life and death situation with COVID. So that is one of the big reasons why. Know that people with pre-existing conditions like diabetes are at high risk of having severe complications when contracting COVID. So we know this. It's not just diabetes, but a lot of the autoimmune conditions, a lot of health issues. I had patients who was battling cancer right in the middle of COVID. And a lot of times they couldn't even get the vaccine because their immune system was compromised. So this is what put them at more risk of having severe complications from COVID. So diabetes, here's what the new research is, and it's frightening for me, but I understand it now. New research suggests that contracting COVID may make persons more susceptible to developing diabetes later. Now, this is some interesting information because I was saying at my office, I couldn't figure out why all of a sudden in January, I was booked solid. Every clinician I'd had, we're booked 2 and 3 months in advance, which is unacceptable because people who are coming in for diabetes education and training want to get in right away. I'm like, what is the influx? My first thought was this is because, as we know, a lot of people were afraid to go into medical facilities in the heart of the pandemic, so they weren't taking care of themselves. So I said, okay, this is my patients from before who are comfortable with coming out and those type of things. But what I didn't realize, it was because a lot of these patients was new who had COVID and had developed diabetes. So a lot more information to come on that, but it's very intriguing about what they're finding out about COVID-19 and its relationship to development of diabetes. So the final question, what are 3 lifestyle changes that can lead to a life without diabetes? If I only had a few minutes with someone who was newly diagnosed with diabetes, this is what I would spend my time talking about. When it comes to meal planning, the first thing I always say to my patients, I'm not here to blow up your world, right? And take away all the foods you love to eat. I'm just here to help you to learn how to have a healthy relationship with food. So one of the biggest misnomers, particularly even in the medical community, when I'm training doctors and nurses, is the idea that carbohydrates must be eliminated. You do that and you're going to wreak havoc. The reason why carbs are the preferred energy source of the body. Why would you remove something that the body is preferring over everything else can use most efficiently? So the key is to learn how to manage carbs in a way where you're able to eat them and still be able to control your blood sugar. And one of the quickest thing I'll tell you for the sake of time is you don't cut out carbs, you bring them out down and you spread them out. You don't cut them out, you spread them. So you don't have tons at one time. So I train patients on how to manipulate the carbs where they can still have the majority of the foods they like, but in moderation. One of the biggest keys to eating like a person with diabetes, as I love to say, is increase your fiber intake. This isn't just diabetes. If you plan on being healthy, you must increase the fiber. Fiber plays such a big role in fullness and helps to lower cholesterol and blood pressure. It helps with weight loss because it gives you a sense of fullness. The trivia about fiber, a lot of people don't know, fiber has no calories. Did you know that? You say, well, what? Fiber is not a nutrient. It's a substance that's attached to carbs, but within itself, it is not an energy provider. It does not have calories. So by increasing your fiber, you didn't increase your calories, but the benefits you're going to get from fiber is going to be tremendous. Above all, decrease your sugar intake. You say, well, sugar is actually, I don't know if you know this, but sugars are carbs. So why am I signaling out sugar when it's actually a carb? Because of the research, sugar has not only been shown to have a significant effect on your blood sugar, but also on your weight. And some new research is powerful. It talks about sugar, particularly when we talk about liquid calories, soda juice, sweet tea, lemonade, that it actually can affect your brain health. How crazy is that? There's also some thought that sugar may be playing just a bigger role in heart disease than fat ever did. So you notice I don't have fat up here because fat, there are some healthy fats. So to eliminate fat is not the correct way to do it. If I had time, I would talk about the types of fat. But no, when it comes to sugar, there's no good sugar except what you find in nature. So when we're talking about fruit, what makes the sugar in fruit okay and then not to be okay in candy, cake, pies, and cookies is because the sugar in fruit is attached to a fiber. You catch that? So when sugar is there, fiber is the only substance that has been shown to hold the rise of the blood sugar. So by putting fiber present, you're going to make the difference. So let me quickly say this as I move on to the next 2 points. Eat your fruit, never drink it. When you drink orange juice, when you drink sodas and juice, you have no fiber there. So eat the fruit so you have the fiber to buffer the response of the sugar. Move more. Cardio, strengthening, and stretch. Now, here's the one that you might want to key in on, particularly with type 2 diabetes, with pre-diabetes, that a lot of people don't know. We always think as women, we go to the gym, we hit it hard on the treadmill, on the elliptical, we're going hard in boot camp, when in reality, the type of exercise that have the greatest impact on reversing pre-diabetes is strength training. Right? There's a whole lecture around that, but understand that the more muscle you have on your body, you higher your metabolism, and it reduces something called insulin resistance, which is a hallmark to the development of diabetes. And don't leave out the stretch. We're notorious for that. Me as well, being a certified fitness instructor, I start to have a problem with something called the hip flexor. For you who know what that is, it's a little muscle that attached to the quadricep group up towards the abdomen and is right there in the groin area. And what I realized is that I was working out hard and not stretching as much as I should. As soon as I start to stretch more, it started to make a difference and not much pain there anymore. So please make sure you get the stretching in. Get up in the morning. I like to get up and stretch up on rising. I like to stretch in the evening too as well. Outside of exercise, I still add that stretch in. You've got to move more. The goal is to move more than you sit. Try to get up and move on the hour. That's what is recommended, not to sit more than 1 hour. There's research that suggests if you sit more than 6 hours a day, you can reduce your lifespan by 3 to 5 years. So digest that a little bit. You have got to get up and move. And finally, lose weight. At least 5 to 7% of your body weight. A lot of times the physicians are saying to you, you know, you weigh 200 pounds, I need you to lose 50 pounds. And you go, what, right? Here's what the research says. With just 5 to 7% of body weight, a lot of times it's enough to take you from pre-diabetes back to normal. So we're not talking about a significant amount of weight. Someone who's 200 pounds, we're talking 10, 12, 15 pounds. We're not talking about 50 pounds. So don't write off the little minor weight loss. All of it benefit. And once you get it off, keep it off. Try not to use these fancy over-the-top diet plans that only set you up for failure. Go in it to win it for the long haul. Thank you.
So before we move on to the next section of our webinar for the day, we want to open it up to questions. You just heard from 2 phenomenal speakers, and they said a lot right now. So you guys feel free to reflect on what you just heard just now about the statistics or some healthy lifestyle choices you can start making, or even ask our speakers some questions. So we're going to open up the floor right now. Feel free to unmic.
So I have a question for Mrs. Hawkins, the registered dietitian. Hawks, yes. Sorry, Hawks, yes. So for the meal planning, the carbohydrates, when you're teaching patients how to spread out their carbohydrates, I know some registered dietitians go based on the latest guidelines. I'm not exactly sure, but I used to teach it when I was working at the prison, and I would do the 45 for breakfast, 45 for lunch, and 60 for dinner. Is that how you're still teaching it? And then they can do up to 30 for a snack in between. How are you teaching your patients based on your profession?
Yeah, that's too much.
Okay.
I've always felt for a long time that's too much, and I'm sure you're going to agree with it now, right? So I normally take patients down from there, because here's the issue. Most people who are have diabetes, when we put them on a meal plan, they need to lose weight, and they're never going to do it by eating that many carbs. Okay, so I look at the macronutrients and separate it in a way where they're still able to get full. I'm going to up that fiber content and up protein too as well. I didn't mention protein in the meal planning for the sake of time, but protein is crucial in helping you to feel full, and along with putting in the carbs, but taking that content down. I usually do about 30 grams, particularly for women, and men no more than 45, but a lot of times I keep them down lower too as well. It depends on the person, but there's not too many people I go anywhere near 60 grams with per meal.
Okay, so for each meal, you're taking them down to about roughly 30 grams. Do you add a snack in there anywhere in between?
Well, how the snacks work, one of the misnomers too as well is that you should be eating every 2 to 3 hours. That's an absolute no. You eat every 2 to 3 hours, you're gonna get fat. Right, so don't do it. When you eat a combination meal, they have a good supply of carbs, high in fiber, protein, and some healthy fat. You shouldn't get hungry for 4 to 5 hours. So the rule is a 4 to 5 hour split. So if there's going to be more than 4 to 5 hours in between your meals, that's when you add a snack. So for instance, if you had breakfast at 8:30 and you have lunch at 11:30, do you need a snack in the middle? No, but you know people who would put one there, don't you? Right. But on the other hand, if you're having lunch at noon and not having dinner till 6, you might want to plop a snack down in the middle. The other thing to keep in mind, every time you eat meal or snack, make sure again you have the carb, high in fiber, and a good source of protein.
Thank you.
Mm-hmm.
One other question, is there a particular guideline that you use? Because I would like to go read it as far as how to, like with the nutrition and how a diabetic or anyone should follow. I know we follow the My Plate, but is there a particular guideline that you follow? Because I know some people follow different.
You know, it's interesting. My plate is kind of general, but I make the point that if a person actually ate half of their plate in vegetables, 1/4 in meat, 1/4 in starch, they probably wouldn't do too bad. Keeping in mind, we're talking about a 10-inch plate, not a 12-inch plate, right? So the other big issue here is portions too as well. I'm not going to talk about it, but I do have something that's in the works to put all this together. The truth is, the plan that I put together, you're going to find what gets confusing for people in education. They still have a lot of the old information, and people who are just coming into diabetes education are using a lot of that old material. I have developed a lot of it through a lot of conferences, a lot of education, and just practical with patients, dealing with thousands of patients over the years, figuring out what works. You know, my diabetes self-management program has about a 95% show rate in my classes. Across the country, about a 50% show rate. Now you say, oh, how is that possible? Because when you're giving people what they need and it's working, they will show up. So that is the key.
And then my last question, I'm not sure if anyone, my last question for you is, and I'm asking because I'm like really big in diabetes education. And so for fruits, because I work with the registered dietitian, and they usually tell patients, and this is good information, and I'm glad you mentioned that most people still use old information, because I know that I see patients with the 60 grams, I'm like, that's still a lot for diabetics. And so I'm glad you shared that tonight, because I'll definitely go back and adjust how I'm practicing. But as far as fruits, we typically tell patients to stay off of the melons and go to the berries. What's your recommendations? I know you said don't drink your fruits, but do you have recommendations as far as what fruits they should eat versus ones they should probably stay away from, like bananas, if they don't have a potassium problem?
Actually, this is going to shock you. There's no fruits anybody should stay away from. What the issue is the amount of carbs. So you have to go back to your basic training is in that a gram of carb is a carb. The only thing that changes the response is fiber. As I mentioned before, it's the only substance that has been shown to slow down the rise. Well, you have fiber in all your fruit, right? So why people a lot of times would say grapes and pineapples and bananas are bad is usually because the person is eating so much of it. But if you took the same 15 grams you found in an apple or you found in a small banana and 17 grapes, you would get the same response. It really is about people eating too much. The reason we go to the berries, there's two reasons. Berries, you get a big bang for your buck. When we talk about a small apple being 15 grams, and by the way, that's what we call one exchange or one choice, you get a cup and a half of strawberries. That's a big difference, isn't it? Right? But nevertheless, the cup and a half of strawberries is going to respond the same as that small banana, that small apple. Does that make sense? So instead of eliminating categories of food, we're going back to the issue of carb counting and portions.
Thank you.
You're welcome.
And Tanya Dawson, did you have a question or comment? Make sure that you unmute so we can hear you.
Okay, can you hear me now?
Yeah, we can hear you.
Okay, so if you're trying to incorporate strength training into your program, what do you suggest to do, especially if you're not trying to bulk up? Should you do resistance training? Should you work out with the free weights, machines? What do you suggest and how often and how long?
Okay, so the recommendation for strength training is at least 2 to 3 times a week, 20 minutes. So it's not tons of time you need to do. It depends on the person. Myself, I do a little bit of everything because I'm a trainer myself. So I do HIIT training, high intensity interval training. I use free weights. I use exercise bands. You name it. But I want to make sure the person does something that's within their wheelhouse. What gets people in trouble a lot of times, I caution my patients against joining a boot camp right away, right? Because what's going to happen, you're going to burn yourself out and the brain's going to talk you out of ever going again. So you got to start small. One of the things I've fallen in love with over the pandemic is YouTube exercise programs. During the first year of the pandemic, I actually worked with a friend of mine who's a personal trainer. I thought instead of training myself, why don't I just let somebody else train me so I haven't given no thought. But I had to have minor surgery last year. And while I was down for 6 weeks, I said, well, I'll see you afterwards. I decided instead to start back slowly. And I went on YouTube and I've been hooked ever since. You can go on YouTube and you can literally put in search beginner strength training exercises. And you have instructors that'll come up with beginning programs. So start off and work at your own pace. The issue is not about building tons of muscle. It's just strengthening where you don't have the, you have a little, what I would say, you can't see me too much, but I always like to kind of prick with nothing's hanging is what you want. But the goal is to just work on strengthening the muscles. And by the way, women can't really build big major muscles unless they're lifting heavy weights, right? And taking in tons of protein. The truth is the average woman with regular size weight, what they're going to do is create definition, not so much bulk.
Okay. All right. Thank you.
Mm-hmm.
And I see another hand is raised. Feel free to unmic and ask your question or comment.
Yes, hi. My name is Arnitha Bowens, and I'm a vegetarian. However, I've been diagnosed with type 2 diabetes, and I do not think that I'm eating a lot of things that will cause my blood sugars to rise. I think mine is more the stress thing because I carry my family on my heart. So my brother was just taken to the hospital. He passed out yesterday, and he's my friend, and I need you to kind of tell me what I can do to help eliminate the stress of carrying my family on my heart. This is for Mrs. Hawks.
That's a tough one. I spent a lot of time, as I told you before, talking to women about just what you're saying.
Yes, ma'am.
We have been trained, and as I said, to be everything to everybody else, me included, have to constantly check myself, right? I'll give you, for instance, just tonight, my husband's supposed to have a big birthday party coming up soon, right? So I was determined not to get involved. Him and another friend are having a birthday party together. They were supposed to plan everyone. Have they done it?
No.
No. And I heard myself say today, you want me to call them? And I was like, stop, don't do it. Do not do it, because what they want you to do is to take over, right?
Right.
And then that's what we do, because we want everything to be perfect. I want to challenge you, as I said before, least put yourself in the top 5. Take some time for yourself. It took me years to get that. And I got to tell you, it's not an easy thing to get. You got to constantly work on it. I'm not asking you to stop caring for the people who you love, but here's a simple question I'm going to ask you. What was your name again?
Arnitha.
Arnitha, why are you stressing out about them and what's going on with them? How they sleeping at night?
I'm sure they're sleeping well.
Like babies. Do you hear me? Like babies. And you're walking and forward, pacing, worrying about them. Right?
And crying. Yeah, and crying for them. Yes.
Do you understand? So I have decided, here's my rule. If they sleeping, guess who else sleeping?
You sleeping.
I am.
Okay.
You got it. So what I've learned to do is do as much as I can, but keep it in perspective. And at the end of the day, I'm gonna ask you this simple question just for the sake of time. If you don't take care of yourself, you know what the consequences can be, right?
Right.
So the question is, what happens to them if something happens to you?
I think they'll go on living.
Well, get some sleep then.
Yes, ma'am.
It's time to go to sleep.
Thank you
You're
for
welcome.
slapping me back to reality. I appreciate it. Bless you.
That is my gift.
Yes, thank you. My next question, my last question is, I sometimes do not eat breakfast because I don't want anything. I'm not hungry first thing in the morning. So most times my first meal is around noon. Like it is 8:25 and I've had one meal today and I'm not hungry.
Okay.
So
you have an absolute no with diabetes.
Okay.
All right. You got to eat throughout the day. And I want to go back really quickly. I think you said you're vegetarian or vegan?
Vegetarian.
So are you a pescatarian or what do you eat? So I have to clarify this because in the Black community, when someone tells me they're a vegetarian, I have people calling themselves a vegetarian who eat meat, eat chicken and fish.
No, ma'am, I can't.
Crazy. Once you eat flesh, you're no longer vegetarian.
That's correct.
Go ahead, Arnetta.
I do not eat it because of allergies. I eat no meat products at all because of allergies.
Good. So no eggs, no dairy.
Sometimes dairy.
Okay. All right.
So that means I'm talking just cheese. So maybe I shouldn't eat the cheese. No,
I'm not saying that. Cheese. You see why I had to clarify, yes, right?
I do. Cream cheese. So I guess I'm a what? Because I add cream cheese to my grits.
You would be a vegetarian, not a vegan.
Okay, right. Vegetarian, not a vegan.
So let me say this first. You said early on that you eat very healthy and you don't understand. You think you're doing very well as it relates to diabetes. One of the biggest groups I have the hardest time with meal planning for diabetes is vegetarian and vegans.
Okay.
Because let's face it, 75% of what you're eating are carbs. You do realize that, right? At least.
Yeah.
So there's got to be a really big focus on how to get the protein up and then level out the carbs. So it's something most people can't do on their own without actually sitting down with a specialist. But don't assume because you're a vegetarian that that you're going to be able to control your blood sugar. In fact, they're the ones who have some of the hardest times because of all the carbs that are present.
Okay. Wow. So I need to make an appointment with you, huh? Or someone, or someone on your level.
Absolutely.
All right. Thank you. And how do we get in touch with you?
I'll put it in the chat. If you don't mind. I don't mean to monopolize everything here. So yes, please, I can put my information in the chat.
Bless you. Thank you for your input.
You're welcome.
And Erica, go ahead and ask your questions.
Sure. Good evening, Ms. Hawks. I had a quick question to clarify in regards to the fasting, specifically intermittent fasting. Is that helpful in regards to diabetes?
Yeah, this is one of the big questions that's always asked too as well. Let me say first, if you're on medication, intermittent fasting is not appropriate. So that's the first thing I got to say. because it's going to be very hard to work around that when you're intermittent fasting. So anybody who don't know what intermittent fasting is, there's different ways you can do it. The traditional way is that you literally fast 16 hours and eat only within an 8-hour period. So you get where that's going to become an issue that someone's taking a medication would have to take in the morning and the evening, when you have to split the doses up 10 to 12 hours apart. And a lot of times it needs to be taken with food. There's certain hypertension medications or cholesterol medications have to be taken with food, other medication, thyroid medication. So if you're on a specific type of medication, please check with your physician before you do something along that line. The only patients I would entertain intermittent fasting with are my patients who in the pre-diabetic range, who are on no medication. And I will watch them very closely when they do it. But even though I think it can be effective in a way, the other problem is I have with it is just like any other fad diet to me. It's not something someone can stick to for a lifetime. So it's setting them up once again for failure when they go back to what they were doing.
Gotcha. Thank you for that.
You're welcome.
And Ashley Dawson has a question for one of the panelists.
Hello, so I was going to ask Ms. Pearson a question. I remember you mentioned stress in your discourse. So I was wondering if you can explain the term chronic stress and how that relates to the severity of chronic conditions in the Black community.
Your question is chronic stress?
Yes.
And how does it lead to chronic conditions?
Mm-hmm.
Yes. Chronic stress is when you're not even taking a break from whatever the situation is that you're dealing with. It just goes on and on and on. And I'm saying it goes on, but you're adding to it as you go through this situation. And then it goes into physical conditions simply because it does play on the organs. You may get to the place where you're not eating properly, so it affects the stomach, it affects the brain, everything is affected. So whenever we get into chronic stressful situations, we really need to get help with it. It's not only the physical man that we need to take care of, we need to take care of the mental man too. And even during this pandemic, we see how people's minds just really got distorted. And there were a lot of mental problems with that. And, you know, a lot of people, even as Sharon was just speaking of, that in the pandemic, we started to gain weight and all of those things that just go on and on and on. And then it becomes a big issue later on. So when we find ourselves in situations where we're dealing with stress, we need to nip it in the bud and start dealing with it. Speak it out. We don't have to try to pretend that we are okay when we are not okay. Okay?
Thank you.
All right.
Tamika, Dr. Tamika, you have another question?
I just wanted to add to what Ms. Pearson was saying, just for an example. So one of the reasons why my passion is for diabetes, because my grandmother, she died very young from diabetes. And she was so stressed out about life, taking care of us, not taking her meds. And so she ended up dying from like 3 stomach ulcers. So what Ms. Pearson is saying is the stomach, if you're not eating, then there's more acid being produced. And so her diabetes was harder to control because that cortisol raises the glucose. And so then she wasn't taking her meds. Yeah. And so it's just harder on the body. And so I know, you know, I have firsthand experience with my grandmother actually dying from the complications of having diabetes with as being a Black woman and not taking care of herself. And so the stress on the body is very real, especially if you've already been diagnosed with diabetes. And so it's important that was a great question. That was an awesome question.
And that not taking medications, I just don't understand why people would pay for medication, then won't take it. You know, it just baffles me to think that this is something that will help you. I like to tell people, and people may not agree with me, but I pray over my medicine and everything to make sure that it's doing what it is supposed to do for my body. But, you know, you read the literature that the doctors, hopefully the doctors give you literature along with your medication. Read it. Don't just put it in the drawer. Read the information. If you have questions, ask your doctor, but do take your medication. Absolutely. And then if you're not going to take it, let your doctor know you're not taking it, because they're basing their charts on what they think that they're doing for you, when actually it may not be true. And then you come in with some kind of additional ailment and they said, well, you took blah, 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 but you didn't take it, you know? So that's very important what you just said about taking medications.
And we have time for one more question before we move on to the next section. If anybody else had last minute comments or questions, feel free to comment on anything that you've seen on the past few slides, your thoughts, how it made you feel. This is an open conversation. Okay, if there's no more questions, we're going to move on. Go ahead and go to the next slide, Ashley. And Fatima, are we ready for you?
So now we're going to talk a little bit more about the program that we're launching. So some fun facts about me. I'm the youngest of 5 girls, so I have 4 older sisters. My mom is somewhere watching this right now because she needs to get up and move. So I texted it to her, like, get on this, get on the webinar. I love bread. We were just talking about carbs, and I just love bread. It's just so good. And I know I shouldn't love it the way that I love it, but like, white bread. Wow. Amazing. Love it. And then lastly, I'm pursuing a doctorate degree in occupational therapy, which I will be starting in the fall. So as I mentioned before, I am the program coordinator of the Black Women's Wellness and Diabetes Prevention Program that we are launching here at Elevate Her. So a little bit of background information before I get into why we decided to do this. According to the National Institute of Health, diabetes is one of the most common comorbid conditions in persons with COVID-19 and a risk factor for poor prognosis. About 1 in 4 Black women over the age of 55 has diabetes. So for a lot of us on this call, you know, a lot of us are, most of us are Black women, and I'm sure most of us knows a woman who's over 55. So when you think about the statistic of 1 in 4, that's 25% of people. So even when I look at it in terms of like my family, I have so many women in my family, just my immediate family, my sisters plus the 5 of us, that's 6. And you're saying that 1 in 4 women have diabetes. That's telling me that, you know, there's a possibility that, you know, 2 out of those 6 women will, you know, at least will possibly face diabetes in their lifetime. So that's something that we kind of are very interested in researching more about, especially with the pandemic and all of the different things that have happened over the course of 2 years, and how health has been, you know, pushed in the forefront, but also there's still all of these ways in which people are not optimizing their health, and Black women are definitely taking a backseat. You can go to the next slide, Ashley. Thank you. So a little bit about our program. We are launching a free diabetes prevention program for women ages 18 to 65 residing in Montgomery County and or its surrounding areas who are at risk for diabetes. So some of the things that we are going to do is take the Center of Disease Control. They have a extensive 1-year, very plain, very dry program that doesn't really, it's not adaptive to our cultural differences. Black women, like we've talked about, Black women face so many difficulties in terms of stress. The things that we do in our community are different. The foods that we eat are different. The diaspora of people in the Black community is so broad. You have Afro-Latinas, you have Haitian, Caribbeans, you have descendants from Africa, you have African Americans. And that poses a different approach to food than other programs take on. So we really wanted to make sure that this program that we're launching is gender specific, meaning it's a team by Black women for Black women, and of course, culturally competent, meaning we're having, nutritionists who look like us, and you're having a mental health therapist on the team who looks like us, and we're having a diabetes prevention specialist who looks like us and who has experienced this, who has a mom who has diabetes, or who has, like Dr. Tamika said, her grandma. Like, we're making sure that our team is reflective of what we are trying to do on the inside. So our weekly virtual classes will be on Wednesday. The duration of the program is from April to June. They will be from 6 to 7:15 p.m., where I will introduce our team on the next slide, but there's a lot of different components that we're trying to make sure are reflective throughout this program. We want it to be structured similarly to how this conversation is right now. You have all of us coming from a community standpoint, being able to really break down barriers and talk about the things that are plaguing us and really get down to the bottom of it. So next slide, Ashley. So this is our team. We have Dr. Tamika Greenwood, who is the Certified Diabetes Prevention Specialist, Miss Erica Phillips, who is our mental health coach. We have Miss Chloe McKinnis, who is our personal trainer. And then we have Miss Kanika Reed, who is our community health worker, who will be working with all of us to make sure that this runs smoothly. So all of these people are a key component into how this program is going to run. We want to make sure that there's someone who can address the mental health of Black women, which is why it was so important for us to get a Black woman with experience in mental health, so that, our participants would feel comfortable expressing those things to her. We wanted to make sure that our prevention specialist was someone who was familiar with, the kinds of foods that we eat on Thanksgiving and the issues that come along with, Easter being in April and those types of things. Similarly to what Ms. Hawks was saying, when we're sad, we eat. When we're happy, we eat. So we want to make sure that we have someone in the community who understands the cultural significance that food plays in the lives of Black women. We are currently we are in the works of, finalizing our nutritionist, who will be helping us do Zoom classes on how to prepare food and taking our, mac and cheese and maybe, tailoring that recipe a little bit, or taking our greens and, elevating it to a way that's more nutritious and healthy for our women. Our fitness coach is going to be making sure that we are staying active, doing Zoom workouts and virtual workouts. And as we get closer to June, and as we move kind of out of this pandemic space, we're going to make sure that we can find a way that we can all get outside and be active. And then our community health worker and support specialist, she is the piece, the glue to this puzzle that will make sure that she's discussing things with the participants and making sure that, all of this runs smoothly. So you can go to the next slide, Ashley. This is our flyer. You can apply by March 30th online. The weekly classes are mandatory with the possibility to make up the dates. Those will be on Wednesdays from 6 to 7:15. You'll get a t-shirt and a water bottle. We'll make sure that you all have accountability partners that you can keep track of. So you can scan that to apply. If you have any questions, my email is there. Feel free to ask me anything. So yeah, I'm really excited for the launch of this program. Ms. Val and I have worked tirelessly over the past couple of months to put this on, and we're hoping that we can be effective and productive in optimizing the health of the women that we care about. So yeah.
Okay, thank you so much, Fatima. We have put the link in the chat, so feel free to apply to enter this new diabetes prevention program. And as promised on our flyer, we do want everybody to engage in some exercise, because we're talking about healthy lifestyles, and now we got you guys sitting almost at a 2-hour webinar, that's not gonna work. That's not gonna fly. So y'all about to do some work. We're gonna play this video and I'm gonna look at y'all cameras too. Everybody turn on your camera so I can see you doing it. We'll do it together. And we're just gonna do this 10-minute exercise. It's gonna be fun, you know? It doesn't matter if we look crazy. Nobody's worrying about it. We're a community. We're trying to get healthy. So Ashley, go ahead and start the video.
Yo, just keep on working. We're getting started right away. Take your time. Pull the stomach nice and tight. Keep those hands up. If your knees hurt you too much, you can't extend as much, then just lift that leg up. Remember, always find a way. Don't say you can't do something, just find something different to do. As long as you keep on moving, that's what matters. There we go. We have 8 seconds. We're gonna raise the arms above the head, doing the same exact thing with the legs. You're going 3, 2, 1. Raise those arms up. Pump them up. There we go. Take your time. We're gonna keep the legs moving. The next part, we're gonna go like this, okay? So you know what's next. Inhale, exhale. Keep that stomach tight. My back is not on the chair, by the way. It's not on the backrest. 3, 2, 1. Let's go. Keep it going. Keep the elbows up. Don't let me see elbows down like this. Keep those elbows up. Your stomach muscles should be tight. You're inhaling, exhaling. I'm a big fan of breathing through the nose, but each person has different reasons. The legs are gonna keep on going. The next one, we're going like this, with a slight bend in those elbows. There we go, baby. There we go. Keep your chin up. Stop slouching. Keep that chin up. Lift that chest up. Be proud. I don't want you slouchy. There we go. Keep on going. This is going to be next. This one is next. If you can't raise your arms above the head because of a shoulder injury, just do like this. Just give me some curls. Okay, let's go. Come on, let's go. Have fun with it. Look how I'm doing the legs. See, I'm doing a double, and then I'm gonna go single. That's right, now double. Yep, now single. We're gonna go to seated jacks in about 3 seconds. That's right here. Pace yourself. I wanna see the legs open in and out. I don't wanna see your knees doing like this. I'm not doing that. Legs in, legs out, okay? We have 15 seconds. Inhale, exhale. We're gonna raise that left leg by itself, bringing the right elbow to that right knee, to that left knee. Come on, we have 3, 2, and 1. Let's go. Give me that twist. Keep that chest up. Remember, don't slouch. Bring that elbow across the body. If you're going too fast for you, slow it down. If you want to hold the back of the leg to help yourself up a bit, feel free. Right now, for example, I'm sore. So this is going to help me a lot. No ego on my side. Come on, baby. We have 5 seconds. I know you're feeling that burn right now. Curse me out all you want. 2. Next side. Let's go. Let's get it. Big breathe in, baby. Come on, big breathe in. Keep on working. What do you want? Results or you want to play games? What do you want? It's up to you. It's up to you. What do you need? I want results, okay? And I'm getting it. So I want you to get it too. I want you to be the next testimonial. 3, we're going here. Let's go, let's go, let's go, let's go. So we're going straight forward. The next 30, we're gonna do the same thing, but the legs are gonna come on the outside. You got it? Of course you got it. Now let me ask you a question. Why is your stomach not tight? Tighten your stomach up. Pull that navel into that spine. Pretend you're putting on some tight jeans and it can't fit you and you're trying to suck that stomach in. That's what I want you to do. Same thing, squeeze those abs. Come on, now on the outside. Let's go. Whew. I've been doing classes all week and I can tell you, I can feel all those muscles that was worked. And man, woo, it works. Let's go, baby, let's go. Woo. Movement, baby, consistent movement. We're gonna mix the front to the side with the leg raise. You get it, don't get confused. Here we go, to the front, 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 side, side, leg, leg, front, front, side, side, leg, up, up, come on. That's it, come on, baby. Move to your pace, but I wanna see everything moving together though. Oh yeah. We have 10 seconds. We're gonna go back to those seated jumping jacks or those seated jacks. You can stand up if you wanna stand, or you can sit if you wanna sit. Come on, I wanna finish this set. I'm gonna finish it up. And let's go. You feel that burn yet? I love Donovan, but I hate Donovan all at the same time. And I can't believe I'm doing this with a chair. Yes, you are. This is a real workout. This is not some baby stuff, okay? This is a real workout. So if you're wondering, then I'll just answer your question. It's a workout. We're gonna throw some punches in 3, 2, 1. Okay, throw those punches out. Go as fast as you want to, but I wanna see that full range of motion. When I throw my punch, I'm twisting the arms. See it? The fist turns and I make a tight fist. And I'm not doing this. I'm extending all the way out. Reach. The torso is also doing work. Inhale, exhale. We're gonna do thunderclaps next. Keep on going. Thunderclaps right here. Bring them up. Keep that chest up. Every time you bring your hands together, you are squeezing your chest muscles. I want you to flex your biceps. Every muscle that you can squeeze, I want you to squeeze. Come on. We're down to our last 3 minutes. We're gonna go back to those punches next. We're gonna do a punch, punch, knee, knee. In 5, 4, 3, 2, 1. Let's go. Punch, punch, knee, knee. 1, 2, up, up. 1, 2, up, up. Punch, punch, up, up. Come on. 1, 2, 1. You can alternate those hands and the knees. You throw left, right, right, left. Come on. We're gonna throw a jab, jab. Come on, let's go. We're going 1. Remember, I don't want your back in that chair. Your back is not on that chair. Keep it tight, baby. Reach those arms out, reach them out. That's you punching those excuses out of here. Get those excuses out of here. Get them out of here. Come on, work. 5 seconds. We're gonna go to that next side, doing the same thing. Next side, let's go. That's it. Work it, baby, work it. I want you to focus on that reach. Remember, I told you that. I can feel my stomach working. I can feel everything working. Why? Because I'm moving correctly. I'm keeping my stomach engaged. Every time I throw that punch, I'm moving the body properly. Come on. We're gonna go regular punches again, alternating. There we go. Come on, reach it out. I don't want you sitting back. Oh yeah, we're down to that last minute now. Come on. Last minute is coming up. We're gonna go back to the first step out to where we started. Gonna advance it just a little bit. Okay, we're gonna go here and then here. If you can't lift both legs up, lift one leg at a time, like this, okay? So I need for you to work. Whoo, yeah. Let's go, let's go, let's go, let's go, let's go. Be surprised, be happy, be excited, be motivated. Come on, baby. You ain't gonna find a coach like this crazy guy. I'm your coach for life. And I'm never gonna let you quit, ever, ever. We're gonna do this for the whole minute. You're gonna finish strong here. Come on, let's go. No mercy. Bam. Yeah, come on, baby. Boom. Oh yeah, that feels good. Keep on pushing this thing. Keep on working. Coming out to that last 10 seconds. Don't tell me you're gonna stop right now. If you gotta yell, yell. You wanna scream, scream. You wanna call 911, call 911. They're not gonna come, because I told them, yo, just keep on working.
Brianna, you're not on, you're on mute.
Thank you, Fatima. Okay, so I hope you guys enjoyed this video. So now we're gonna talk about what's next. So we do have a bonfire link where we do sell some stuff, because a lot of things we do with Elevate Her is for free, because we really just are trying to help the community. So this kind of helps us continue to do that. So feel free to buy some Elevate Her swag. We have t-shirts, sweatshirts, long sleeves. So there's different ones you could choose from. And we will drop the link in the chat, but you can also access it through the Linktree link as well. Next slide. So we're also going to post in the chat the post-event survey. And we want you guys to actually do both. I hope you guys were able to do the pre-event survey before, but we like to compare this to see if there was any change in, did you guys learn anything? And especially that you guys had some takeaways from the event. Then we also want you guys to sign up for our mobile app. Again, you can get all of that on our Linktree link. So that way you don't have to search for all these different separate links. And then follow us on social media so that we can keep growing and keep doing this. So I'll give you guys a moment. I'm going to start dropping the links in the chat real quick. Okay, so you should be able to see all the links now in the chat. We have the diabetes prevention program where you can sign up now and apply now. We also have our post-event survey, so please take 2 minutes to fill that out real quick. And then you can even follow us on social media. Next slide. So we have an upcoming webinar, and that one's actually going to be focused on mental health. And it's going to be April 25th. And again, if you go on that Linktree link, you'll be able to see the date and sign up for it and get the free registration. And again, we'll have a Zoom link that will be sent out. So feel free to sign up for that now. And then we're also looking for some, youth community, because we're helping adult community. We want to help our youth community as well. We care about their mental health as well. So that's really what the webinar is really about. So we do have our Join the Montgomery County Black Youth Advisory Council, and the deadline was extended to April 4th. So if you know anybody who will be interested in doing this, they're going to create a survival guide and help us feel more tailored to the youth community, because we're really tailored to the adults, but we want to watch out for our kids as well in this community. But you can also tell them that they'll get paid for this as well. So they will get $100 by the end if they go to all of the sessions, and you can see the dates for each session on there as well. And that'll be via Zoom, so they don't have to actually physically go anywhere. It's still going to be virtual. And next slide. So one of our sponsors, or where we got our grants from, is the Black Physicians and Healthcare Network. So they do have a spring health fair that's also coming up. So feel free to take a screenshot of this. This is Saturday, April 9th from 9 a.m. till 1 p.m. And it's at White Oak Community Center. And you can also see the address on the flyer as well. So feel free to take a screenshot. And next slide. So thank you guys again for coming. Please fill out that post-event survey if you haven't done so already. Feel free to scan the QR codes. That way you can get to all of our social media accounts. And thank you guys so much for coming. If you have any more questions, feel free to email us or drop it in the chat right now and we'll send it to the speakers. Thank you guys so much for coming.
Thank you to our speakers for speaking today, Ms. Hawks and Ms. Pearson. We really appreciated it. And the diabetes prevention team who came to support us, thank you all as well. Again, if you have any questions, feel free to reach out to anyone who was on the webinar from my team today. Thank you all so much.
And just a quick note for me, I would also like to say, please take time to share your thoughts of this webinar. We truly value your feedback to gauge our impact in improving the community with awareness, engagement, and mobilization. So let's just hear a few responses, how you guys feel, put it in the chat. Thank you.
So again, the links are in the chat, so feel free to fill out our post-event survey now. It'll take 2 minutes before you go.